your union can serve you and you can serve them. And it's always been that fundamental basic to care and keep the caring and compassion in nursing. And that's by caring for each other and helping each other. And the union offers that, and they've only increased through the years. Anytime one of my family members has been sick in the last while, I know how stretched the nurses are on the units or wherever they are, and feel like you should be there to help out, because you know that they can't give the kind of care they want to give because staffing is so short, and they feel like they should be an octopus, like you should have 8 arms and be in 6 places at 6 times, and you can't. We're all human. The reason why it is so hostile and unhealthy is because of what they're requiring people to do. They're requiring them to work 12 hours. They're requiring them to work on their days off. I know nurses that have been called 8 times on their day off while they're sleeping from getting off nights. I think that's part of our profession again. We're so used to giving, caring and giving, that they call and they say, they use all kinds of stunts. Can you help your nursing colleagues, please? They are 3 short today. We desperately you need to help your staff. You know, can you come in today? I've worked the last 4 nights, I'm exhausted. Your colleagues really need you, you know, like they try all those stunts, you know, like it just doesn't stop. So I've heard stories of nurses who have called in desperation and said, I'm just so exhausted and I don't know what to do and I'm ready to leave the profession. And I'd say, well, tell me what's going on. Well, I just finished working like 14 shifts in a row, and back up, how many did you have in your rotation? And why did you work extra shifts? Because my manager or let's say a booking clerk, an employee of the manager or of the facility, called me and in desperation said, your colleagues need help, please come there. Or they leave an answering machine message saying, we need you to work. I know it's your day off, but please, please come in. Overtime's not the issue. It's not payment anymore. It's an issue of health. It's an issue of safety. And people are saying yes. And why are they saying yes and going in and working these additional shifts? It's because it's that caring and compassionate side of nursing. I mean, that's why we enter, to help people, to work with people, to help care and have that compassion. So a nurse says, yes, I'll come in because I want to help my colleagues. I want to care for the patient that I took care of last night and make sure that he has a nurse tonight. If I'm not there, he won't have a nurse. And they go in, but it's like their 14th, 15th shift, and they're exhausted and they're tired and they're really not safe to be there.